Working with the Asian ENT Care Center located in Panjagutta, Hyderabad. Now we are seeing many patients who are coming with the nasal dryness, decreased sensation of smell after they recovered from the COVID. Many patients, they are saying burning sensation in the nose, nasal pain, decreased sensation of smell, and they say initially we thought it will recover, it is not recovering. They are coming after 2-3 months of the COVID recovery. This is mainly because this COVID virus infect the epithelial cells of the nasal mucosa, that is on the turbinates, nasal septum, middle meatus, along with the olfactory epithelial area. Whenever it damages the epithelial cells, if we don't reduce the inflammation immediately, this inflammation persists for some time, it will damage the epithelial cells and it will cause the fibrosis. So when healthy epithelial cells get damaged, fibrosis forms, underlying neural cells will expose. So in that situation, when that nerve ending is exposed, if there is any little bit dryness also, it will cause pain and burning sensation in the nose. Same way, epithelial cells of olfactory epithelium, these also get infected by the COVID virus. When this COVID virus infects olfactory epithelial cells and supporting cells along with the nerve fibers, if inflammation persists more than week or 10 days on that area, these cells get damaged permanently and it will replaced by the fibrosis. So smell sensation will get decreased. So after COVID, because of this cell damage, fibrosis and nerve exposures and nerve damage, these cause these problems. In this situation, what we do, we first always take nasal endoscopic evaluation and a CT scan of the paranasal sinus. Because in CT scan we have to rule out always any sinusitis, because in COVID recovery patient there is a chance of the fungal sinusitis, especially diabetic patients, obesity patients, allergy patients. So you have to do the CT scan. If CT scan shows any pathology, sinus problem, you remove it and send for the test. If there is a fungal infection, give antifungal drugs. If there is no fungal infection, just you treat infection and leave it. But decreased sensation of smell, if you act very fast, maybe there is a chance of recovery of the sensation of the smell. In this situation, we give that means local platelet rich plasma injections. These platelet rich plasma have vasodilator factors and growth factors. This will increase the growth of the olfactory epithelium and blood vessel dilatation, thereby it will increase the healthy mucosa. So if you have any burning sensation in the nose or decreased sensation of the smell after COVID, contact Asian ENT Care Center. We do all examinations and we do the best treatment to recover your problem of the burning of the nose and decreased sensation of the smell.